A5, but oh well. Just places to fireplace ashes. Turn the elevator left side area to suspended. What? Left atrium or right atrium. Okay. College physician every biology should be on the right side. Oh, that's good. Radio frequency catheter and ablation. P was not associated with Gauss complex. So there's no premature P. Well, I see elevated ST segment over here at least. Well, that's the next P. PRS. There's one SPL. Cardiology, for temporary pacing. Third degree AV block. Pulse boosted. Rapid response to initiate depending on the client's condition, however, cardioversion is performed. Third degree AV block is lifetime. Okay. SA AV. Okay. SA AV can go through. for your kids. They don't know a lot of tests. The sickness necessity is proximal. I forgot the opposite of proximal. I know now. Avoid arm manifested after. Well, do not make further attempts to draw blood by one individual, but you should still. Distal. Distal and proximal. It would be proximal, so you're not drawing up the medication. What am I doing? I gotta go 1 point there. Okay, let's see. Got 0 points here, and I got 1 point here. Not doing good. You diagnose heart failure from low literacy level. Teams try to conduct teaching lessons. Listen. Okay, this could urge the client needs to know. Have a client watch DVD heart failure management, print out pictures, food label, review our books, sodium content, speak slowly and loudly. You don't need to speak loudly. Low literacy level. One-year-old. Certain more information. Good time to start when your child can dress, undress autonomously. Yeah. Start toilet training, communicate and follow directions. I think that's more important than I honestly think in order to achieve toilet training, you need to be able to dress and undress. Okay, dress and undress autonomously is not the same as pulling down their pants. Okay. Cool. Emergency department diagnosis rule out MI with test. Troponin. D-dimer? I forgot what it's for. LDL, what is D-dimer test for? I studied this sometime today or yesterday or something like that. Oh, do you have an ID for What's the component level for myocardial infarction? Just trying to figure out what D-dimer is for. Oh, I guess it's supposed to tell me, right? D-dimer cross-link firing result from clot degradation. Oh. Standard professional care given with good intention, best. Professional organization. Clinical practice statement of professional organizations. Okay. Professional. That's a key word, I think. Mitral valve prolapse. So mitral valve is on this side of the heart. This side is actually the left side. So left-sided heart. Palpitations, dizziness, health. Prescribe beta blockers. Beta blockers can cause not angioedema, can cause coughing, bronchospasm, and I'm out of here. You don't need that. Stay well hydrated and avoid caffeine. Adopt healthy eating and avoid caffeine stimulants may exacerbate symptoms. I shouldn't have. I'm getting too stuck up in my head. Okay. Nurse prepares and administer a prescribed dose of sodium something something to a client with hyperkalemia. I was saying that doesn't make a lot of sense because education doesn't. It's not the first priority. So then I was like, what else could be? The client experiencing frequent loose stools being therapy. Daily weights are important to evaluate, but reassuring normal function. I think I should have applied had applied here. Assess client abdomen fever. Okay. Unless you can for client intracranial pressure. Okay. Cushing's triad. Deep breathing and coughing exercise. Ah! My God. Almost withdrawn? No. Oh. After even less restless, you could be going to sepsis. Okay, your temperature would be higher. I'm just kidding. I fucked up. Stages due to substance withdrawal and alcohol withdrawal. This, yeah, I think. Oh, even okay. You should avoid fatty foods in general. What? No, 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 no. 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 I disagree with that. Oh, bats? Okay, not bats. I did not read that. Okay, come on, focus now. Read the question. 12 questions to go over 21 questions. 12 minutes to go over 21 questions. Regarding home oxygen use emphysema using nasal cannula portable oxygen. I can continue. No. Require a follow-up. Oh. I think it's Beck's triad. So distant hard tones, jugular vein distension, and what's the third one? Bradycardia. No, it should be tachycardia with Brady. With hypotension. Decrease. Yeah, this is Beck's triad. Muffled distant hard tone. Good. Good. My studying is actually working. But that's not me. And then virtual's triad is hypercoagulability with the other two stuff. Um, epithelial and endothelial damage and venous stasis. And then there's Cushing's triad, which is wide pulse pressure, regular respiration, bradycardia. What else? What's the other triad? Cushing's. We did a triad yesterday with respiration. Oh, virtuals. Oh, we already did all the triads. There's no triad today. Okay. Knee replacement surgery. Ooh, okay. Most concerning, falls asleep while talking nurse. 2 days? I think that's fine. I don't know what pruritus is. Pruritus? Episode of non-bilious emesis. Oh, that's concerning. Aspiration? Fuck. Okay. Surgery, blah, 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 over sedation. Okay. Fetal respiratory, sure. One time, opioid, blah, blah, blah. Other medication and sex and generally pain relief. The client falls asleep during conversation, overly sedated. Okay. Constipation is a side effect. I agree. Nausea and vomiting, common adverse effect of opioid. Okay. Okay. Oh, pruritus. Pruritus is a itchy. Oh, yeah. Because when they come up from anesthesia, we always protect their eyes, and we try to keep their hands away from the eyes because they're gonna scratch the eyes out. Okay, so that is normal. That is normal. And this is normal, I guess. This is not. This is also normal. That is not. Especially post-op. Hydromorphine. Yes, I agree. Agree. Nah. Assigned. Okay, for assigned language defined condition, there's appropriate. Okay. No! No! Stop! Okay. You can do that, no. Assisting the first pouch change. Why can't you assist with that? However, the client you also require assessment and teaching, which must be performed for a client. Okay. Record intake and output. I should have clicked that. I'm not reading my questions today. I'm distracted. RN and a practical nurse. Care for client limited to unit last note with the moderate asthma and activation delegate to the PN. I think this is an LPN, which means it's like a nurse tag. Administer albuterol. check oxygen saturating, which you can do that for sure. Measure, monitor peak expiration, no. Peak, I think you can do that. Teach client, no. Auscultate sounds to determine the response to bronchodilator. Okay. Okay. Yeah, that's right. I think you can administer it. You just can't like do a lot of the assessment and the teaching stuff, right? Monitor RN finding, reinforce education, routine procedures, most medication, tube patency, enteral feeding, specific assessments. Nurses providing anticipatory guidance for the Alzheimer's and osteoporosis. Current symptoms include mild forgetfulness and cognitive changes, with an example of goal anticipatory guidance. Within a proper organization of medication and a weekly pill box at the end of the teaching session. Yeah, we should do that. Identify and attend support dementia by the end of the month. Which is the best example of an educational goal for anticipatory guidance? I think it's the drugs. Overrides 2 home safety that prevent falls, disease progression by the end of session. Why is number 1 not right? Should be used now while the client has only mild. Right. Future health needs. From pediatric development. This type of education promotes health that helps reduce blah blah blah. Client-oriented, realistic, objective, measurable. Focus on preparing. Feels like a smart goal. There are like 2 homes that prevent falls. I can prevent falls during disease progression by the end of the session, as opposed to medication, because that's what you need now. Okay. 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 Yeah. Okay. Okay. Yeah. Okay. First aid post-op by having minimally invasive direct coronary artery bypass. Grafting. Okay. I don't think that's true. Well, I don't know if that's true. Um, I just know this one doesn't answer the question. So was it easier and ask why it's so painful to take deep breaths? Yeah, I just know this one doesn't answer the question. A client needs to move, blah, blah, blah. However, the client is asking this question about addressing reinforcing these teachings. Okay. Yeah. Okay. Cool. Receive report of the following client. The client should, the client should, which client should, okay, 4 hours post-op, colon resection. That's a little low. Health of good, stroke respiration, 20-second period of apnea. Oh, uh-oh. 7, 8 to, it should be 8 to 20, 8 to like, I want to say 8 to 26. I want to say 8 to 26. I think it's a little low, but I think you're okay. Pulse of 110 after ambulation, just sit back down. Rapid, deep aspiration. Deep respirations. DKA is not good. Well, you're in palliative care, so I don't. You're dying anyways. Um, Post-op following resection has a blood pressure. That's internal bleeding. I like to see that. Yeah, Kuzma's bleeding. Blah 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 blah. At first, hypovolemia, early septic shock. Yeah, I was like, that is not good. Wow, I actually got this right. Cool. Nurse caring for client receiving mechanical ventilation. Whoa. Okay. During multidisciplinary morning rounds, the healthcare provider questioned the development of ventilator-associated pneumonia, ocean following medication. Best indicator. The best indicator is probably a positive sputum. Ventilator-associated pneumonia. Culture. Culture is the the best indicator. Is associated. Positive identified, not the best indicator. It's the sputum culture is the most accurate. This is a culture. Um, New medication, hypertension, exacerbation. Oh, oh god. Okay. Exacerbation of COPD. With hypertension exacerbation. Okay, so it's hypertension and COPD. Ipratropium is used for COPD, so that's not it. And Lodipine, codeine, prednisolone. Prednisolone, I believe, is also used for COPD. I think it's codeine. It might be amlodipine. I feel like it's codeine though. Okay. Amlodipine is. Oh, it's a calcium channel blocker. Okay. It's a calcium. I need to look at the calcium channel blockers medication. Calcium channel blocker. What is it called? It's called Pixaris. And Plex.
Dihydropyridine calcium channel blockers are a class of drug that cause arterial vasodilation, used to lower blood pressure in order to treat hypertension and angina. In this video, I'll teach you my visual mnemonic to remember the names, mechanism, clinical uses, and side effects of the DHP calcium channel blockers.
The DHP calcium channel blocker. Diphenhydramine.
So you'll be ready come test day. Ooh, an ice cream stand. That's on a hot day like today. But this isn't just any ice cream stand, it's a Dippin' Dots stand. Notice the DHP in the Dippin' Dots sign? The DHP and Dippin' Dots can help you remember that we are talking about DHP calcium channel blockers. And not only that, all DHP calcium channel blockers have the ending dipene. Get it? Because Dippin' Dots kind of sounds like dipene. You can even remember dipping dots. On test day, you might see drug names like amlodipine, nifedipine, and felodipine. But since they all end in dipene, you'll know right off.
I thought verapamil is also verapamil. It's also a calcium channel blocker, but it's a different type, I think. It works by relaxing. You can't use this with digoxin and theophylline, but I'm trying to figure out. Oh, there's two types of. Oh. Utilism. Okay.
Off the bat that they are DHP calcium channel blockers. Now, you might have heard elsewhere that calcium channel blockers end in pene, but actually there are several other medications that end in pene and aren't calcium channel blockers. Take atropine, for example. That's why these Dippin' Dots will help you remember to look for the full ending, dipene. Let's get some Dippin' Dots, shall we? Looks like we'll have to get the worker to help us. There's no way we're getting past that big lock without a key. By the way, this lock on the ice cream freezer can help you remember that we were talking about calcium channel blockers. Because ice cream has a lot of calcium, right? The lock is blocking the ice cream, just like this medication blocks the calcium channels. Maybe we should ask that jogger if she needs help. It looks like she's tripped and is falling right into this Dippin' Dots stand. And grabbing onto that umbrella doesn't seem to be doing her any good. Notice how the hole in the fabric there is widening and getting bigger as she falls. That reminds me how calcium channel blockers cause arterial vasodilation. You know, a widening hole for vessel dilation. You see, calcium normally enters the walls of blood vessels via the calcium channels in order to cause the vessels to constrict. So, when the calcium channels are blocked, say by amlodipine, the vessels instead dilate. This works to decrease the blood pressure by way of reducing vascular resistance. To understand why vasodilation decreases blood pressure, think about the analogy of a garden hose. Letting go, or dilating a squeeze on the hose, reduces the resistance to flow, causing the water, or blood, inside to spurt out with less pressure, right? This ice cream freezer isn't doing a very good job at keeping the Dippin' Dots cold. And because of its deflated tire, the worker can't move it out of the hot sun into the shade. Just like this tire pressure is decreasing as the tire deflates, calcium channel blockers are used to decrease blood pressure. Got that? A deflating tire for a decrease in blood pressure. Calcium channel blockers are used to lower high blood pressure. In other words, they treat hypertension. They do this through the mechanism we just talked about, atrial vasodilation. In addition to lowering blood pressure, there's another clinical indication for calcium channel blockers. So let's move on. Yeah, the longer I'm watching, the more I think this jogger needs a hand. She looks like she's in pain. Especially with the way she has hit her chest on the ice cream freezer like that. Ouch. By the way, another common clinical use for DHP calcium channel blockers is angina or chest pain. This jogger getting hit in the chest is our symbol for angina, because you bet her chest is in pain right now. Angina is usually caused by insufficient blood flow to the heart to meet its demands. One of the ways we can remedy this is to decrease the work of the heart by reducing the resistance or pressure that it has to pump against. And what do the DHP calcium channel blockers do? Oh yeah, they conveniently decrease blood pressure, which obviously reduces the work and oxygen demand of the heart, thereby treating angina. Got that? Let's move on. Oh, now I see why the jogger is falling. It's that broken Dippin' Dots freezer's fault. Since the worker can't move the freezer out of the sun due to the flat tire, the ice cream inside the freezer is melting and leaking out of the bottom. which cause the jogger to slip. This leaking, pooling liquid kind of reminds me of edema, because edema is essentially fluid leaking out of vessels and pooling into the interstitial space. You can use this leaking ice cream to remember that one of the biggest side effects with DHP calcium channel blockers is peripheral edema, which basically manifests as swelling in the hands and feet. The finding of edema should make sense actually, because peripheral edema is often a downstream effect of vasodilation. In fact, all the side effects we're going to talk about today are directly related to the vasodilatory effects of calcium channel blockers. This jogger must have been running pretty fast. That's probably why she didn't see that puddle of melted ice cream. I can tell she was hustling because of her red face. Flushing is actually another side effect of DHP calcium channel blockers. Flushing is the result of increased blood flow to the superficial skin and face due to vasodilation, which, as we covered, is the main mechanism of these drugs. Again, use this runner's red face to help you remember the side effect of flushing. Now, take a look at the jogger's fitness watch. These watches are really handy for exercising because they can tell you what your heart rate is, and it looks like this runner's heart rate is really high, which is what you'd expect from someone running, right? This fast heart rate on that watch is our symbol for tachycardia. Calcium channel blockers can cause reflex tachycardia, which is the body's way of responding to or compensating for a sudden drop in blood pressure. The heart is beating faster in an attempt to pump more blood out to restore blood pressure. I wonder why this Dippin' Dots worker didn't step in to help this poor jogger. Wait a second, I know that look on his face. He has a brain freeze. In fact, headache is the final side effect we want you to remember for the DHP calcium channel blockers. Brain freeze for headache. Easy, right? Calcium channel blocking drugs like amlodipine can cause headaches due to an unclear mechanism. The final thing you need to notice is this sign taped to the ice cream freezer. Oh man, looks like they're all out of the grapefruit flavored Dippin' Dots. It's no wonder, now that we've seen how fast the Dippin' Dots worker has been eating them. In fact, I think he is eating the last of the grapefruit Dippin' Dots just now. Just like how this ice cream stand is out of grapefruit flavored Dippin' Dots, patients
Dippin' Dots. And Lodipine.
who are taking calcium channel blockers should stay away from grapefruit juice. Grapefruit juice prevents the body, and more specifically the liver, from breaking down the drug, meaning that the drug levels in the body increases to potentially cause severe hypotension. If you see a question on the NCLEX about DHP calcium channel blockers and diet, remember that your patient should stay away from grapefruit juice.
No grapefruit.
That's it for the DHP calcium channel blockers. Let's do a quick recap before we wrap up. DHP grapefruit juice. That's it.
Alright, I'm gonna take notes on this while it's going. I don't like this one.
For the DHP calcium channel blockers, let's do a quick recap before we wrap up. DHP grapefruit juice. That's it for the DHP calcium channel blockers and diet. Remember that your patient should stay away from grapefruit juice. That's it for the DHP.
Wait. Cal. See it. Is it DMP? DHP. No. Excuse me. No. Let me just look at some images. I bet there's something. Okay, I'll have to. Okay. Well, that's fine. Is there any way I can? There we go. No? Okay, I'll include that on my, just for me. Okay. If I do this. That's right.
YouTube app. Okay, so here we are back on the home screen of YouTube, corner, on ability. Enter into the accessibility setting. Accessibility, just tap to disable that setting. And
calcium channel blockers consist of medications that end in dipine, including amlodipine, nifedipine, and felodipine. These drugs work by causing arterial vasodilation, which has the overall effect of reducing blood pressure. Clinically, these drugs are used to treat hypertension and angina. Side effects include peripheral edema.
I've been wanting to do calcium channel blockers for a while. Calcium channel blocker. Get a tablet. Calcium channel blocker. Where did my tablet go? Oh. But I have not been out of this house since like Saturday. It's been like 3 days. 2 days, 3 days. Something like that. Something like that. Crazy. Okay. Alright. So today we're starting the 7th drug. Calcium channel blockers, calcium channel blockers, calcium channel blockers, calcium channel blockers. Okay. Alright. So let me just try to remember this. So it's a calcium channel blocker, and it ends in peen. No grape juice. It can create edema, lower extremity. Edema. That's one of the largest side effects. Tachycardia. It vasodilates. And we have headache. Side effect is headache. And treats angina. This is a side effect, by the way. Side effect, lower extremity. And then treats hypertension.
Flushing, reflex tachycardia, and
Oh, I forgot flushing.
DHP calcium channel blockers consist of medications that end in dipine, including amlodipine, nifedipine, and felodipine. These drugs work by causing arterial vasodilation, which has the overall effect of reducing blood pressure. Clinically, these drugs are used to treat hypertension and angina. Side effects include peripheral edema, flushing, reflex tachycardia, and headache. Last but not least, effect of reducing blood pressure. Channel blockers consist of medications that end in dipine, including including amlodipine, nifedipine, and felodipine. These drugs work by causing arterial vasodilation,
vasodilation,
which has the overall effect of reducing blood pressure.
Blood pressure treats hypertension.
Clinically, these drugs are used to treat hypertension and
hypertension is at the bottom, and
angina. Side effects
include headache, peripheral edema, and
include
flushing.
peripheral edema, flushing, reflex tachycardia, and headache. Last but not least,
and then last but not least,
patients taking calcium channel blockers should avoid grapefruit juice.
no grapefruit.
Thanks for joining us.
Yeah. Okay. Cool. Cool. Okay, we need to turn this Discord off. Alright. So why exactly putting cough suppressant? Okay. So amlodipine ends in pene, so we know that it's like the dipping thing. The DH pin. Alright. Let's name this calcium channel blocker. Okay. Alright. Fuck. Okay, calcium channel blocker, NMPene, and not angioedema. Peripheral edema, we treats hypertension and angina. Actually, angina's treat with Mona. Morphine, oxygen, nitroglycerin, and aspirin. But I guess you can also treat with calcium channel blockers, amlodipine. And then wait, hold on, let me go back. I don't want that to mess up my time. And then calcium channel blockers also vasodilate, so flushing. We're gonna get reactive tachycardia. We're gonna get headache and all that jazz. Oh, left. Right lower quadrant pain. Right lower quadrant pain. Appendicitis. Oh no. Oh no. That means it ruptured. Oh no. Oh no. I'm gonna go to the bathroom. Oh no 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 no. All right. Now where's my music?
I said, watch you and love is everything. Bruce, older, wiser, die. Wait, I was just a kid. You was my best host. Shit. Lazy with the fancy shit. And watch you talk to me. If it's not what it's tell me who I'm so I'm not actually celebrating. Tolerate. Create you. Taking discretion's all good from. I said this. I'm college grades lately endless. Bruce, older, wiser, die. They got this one, just a kid. My best helps for your poetry. They didn't say fancy shit. Now watch you talk. It's not like somehow. No one actually celebrate. Choose tolerate. You want to world's star. As that man playing gigs above all floor. I'll meet you to
I think he has diabetes. From what I can see here, frequent requests to the bathroom and uresis at night. But it can also be like due to the new change of location. But multiple behavior outbursts, frequent reporting of thirsty. That's a very big sign of diabetes. Okay, behavioral regression. Uh, urinary frequency. Diabetes mellitus, fatigue, irritability. Oh, this urinary frequency, polydipsia. I don't know if diabetes has irritability? I like to say that. Most likely experiencing diabetes and requires glucose management and to prevent hyperglycemia. I think that's the most likely cause, because there's no UTI, glucose. Oh, urinalysis, yeah, diabetes. Track, rotate injection sites, or a medical alert bracelet. I don't think you. Maybe demonstrate insulin injection on adult. Yes. Store unopened vials at room temperature. Sure. Wear medical alert bracelets. I don't think they do that. Maybe they do. They probably do. I'm probably capping. 3 days later, a school nurse called Clara because diaphoretic unconscious. Oh, medical bracelet. Ah, God. Obtain snack 15 grams of simple. That's probably true. Oh, I didn't even look at it. What am I doing? What the fuck? I'm just like, it's probably low. Indicates correct understanding of matter of type 1 I need to administer it more frequently when my child is ill. Insulin? You do not need to do that. Yes, insulin will be injected to the feet. Enough to eat? No. Overnight social media should be avoided. Prevent changes. No. Drop. Poor diet can eliminate. Proper diet. No. No. I think that might be right. Okay. With type 1 diabetes, wait, I want to look at one. It can increase with illness because stressful events can cause glucose levels to rise. Oh, yeah, because I was thinking like it's gonna rise, so I guess so that's why you need to decrease it. Administer subcutaneous glucagon. This is hypoglycemia. So why not 4? Oh, she's unconscious? Oh, and becomes unconscious. Okay, that's my bad. That's my bad. Did not read. Not appropriate. Okay. Rotate injection site where medical. It should be. You should wear medical appropriate. It's not appropriate. Storing it unopened. Where should we store it then? The refrigerator open. Okay. What? I got. Oh. Fatigue, irritability, with regression. Okay. And then nocturnal. Oh, yeah. I wasn't reading that. Weight at 20. I was thinking about that. And then I was like, oh, maybe not. No, maybe not. Okay. Read the question. God damn it. Receiving report for client. Assess first. Okay, receives report on 4 clients. Which client should the nurse assess first? Pilot cell on his right foot. Hydromorphone 6 out of 10. I think you're fine. Maybe chronic hemoglobin at 8, hematocrit at 24, reports shortness of breath and activity. With activity, then just don't do that activity. Heart failure exacerbation, peripheral effusion, serum 130. Oh, what's low? That is low. Should be 135 to 145, and 132 is below. Pneumonia and asthma resolve now appears to be resting. Sudden decrease in after a sudden decrease in wheezing. Okay. I was like sudden? What? I want to say 3. Is sudden wheezing status is asthmatic, is respiratory failure, unconscious, and death. Oh shit. Airway management. However, even after medicating, the priority assessed lung sounds working in unconsciousness, a sudden decrease in wheezing may signal to normal with a silent chest, where airflow is rapidly reduced due to the increased bronchial constriction. Okay. I was like, sudden is very sus, but then I was like, sudden decrease in wheezing. No, they should have wheezing. Okay. Heart failure, shortness of breath is expected. Yeah, that's expected. My grandma has shortness of breath all the time. Okay. We're halfway through almost. Neural trauma receives neural trauma unit receives 4 clients. Again, which one should the client assess first? Neurogenic shock from spinal cord injury, the pulse of 56, blood pressure of 120/60, warm and pink skin. You still have good perfusion. Concussion, closed-headed injury due to a fall, glaucoma of 15, headache, and a memory loss. Oh, glaucoma scale of 15. No. Closed-head injury due to a fall. I mean, concussion is very important, but subdural hematoma, pulse 48, blood pressure 190/90, and pupil reacts slowly to light. Oh, that is bad. Pulse of 48? It should be 60. Central diabetes symptoms of head injury, hypernatremia, and urine output of 220, 210 per hour. Okay. So, central diabetes insipidus with a head injury. Diabetes insipidus dry inside. So that is expected. Hypernatremia is expected. So it's not 4. Neurogenic shock from spinal cord injury, pulse of 56. Again, that is not as bad as that. And due to a fall, I think it's this one, yeah. Intracranial pressure, Cushing's triad, hypertension. Let's see, hypertension, bradycardia, and I should look for Cushing's triad. Hypertension, irregular respiration, and bradycardia. Or why did pulse pressure, bradycardia, and irregular respiration? It's interesting how it's all like, I guess Bex's tachycardia. Well, it's like decreased blood pressure, jugular vein distension, and awful heart sounds. That's pericarditis. All right. Cardiac tamponade. Emergency rescue from burn building. The client's arm and chest are filled with dry, leathery, charred skin that does not blanch. Arm and chest. So this is 9% already. This is 9. You do lactated ringer first. Burn injuries, well, ABCs. So circularization, extensive burn, increased capillary fluid electrolyte shifts, decreased intravascular volume. These intravascular losses begin rapidly after a burn, happening in shock and death. Therefore, prioritize fluid resuscitation. OH fluid, lactated ringer first. Postmortem care, client who died after long hospitalization, and I do not resuscitate. An autopsy. I don't know if you remove the dentures. During postmortem care, call medical examiner for autopsy, place pad under the perineum. I mean, they're gonna poo, so yeah. Okay. Gently close eyes, remove tubes, straighten wash body with changes of linen, place pad, absorb. Yeah, because everything's relaxed, so they're just gonna poo and pee all over the place. Place a pillow, prevent blood from pooling and discoloring of face. Oh. Replace dentures? Dentures are left in place or replaced with after maintain shape of face. A towel can be folded. Keep the jaw closed. When you're dead, you're just like. And you close the eyes, up, denture, and then everything's relaxed. So, yeah, cool. That's fucked up. I'm smiling. I got the question right. It's great. Telemetry unit, an assigned client develops asystole. Asystole! With no pulse. Okay. Why are you applying oxygen? Wait, whoa. Start CPR. Provides defibrillator shock. Maybe. Oh, start CPR, give oxygen, and initiate chest compressions. Total absence, pulseless apneic. The client should monitor CPR. Why no defibrillator is not indicated when there's no electrical muscles contracted despite an organized rhythm. Oh. Right. I agree. Let's review calcium channel blockers. Enzapine is used for anginas and hypertension, can cause lower extremity edema or peripheral edema, because it can happen in the hands too, but mostly in the feet. And it widens the blood vessels. It can cause headache. It can cause edema. It can cause flushing. And no grape juice. Am I missing anything? Let's see. Nope, I'm not missing anything. Well, other than the tachycardia, but it's like sure. Okay. Coney Island. What was the? I want a little folklore. I like folklore actually. I really like folklore. The longer the time goes, the more I like folklore. Evermore is alright, but folklore is the jam. Okay. Receive shift report. Which one have you seen first? Abdominal aortic aneurysm repair hypoactive on all 4 quadrants? Yeah, that makes sense. Below the knee amputation, who reports same leg foot pain with 7% out of 10. Or second time? Okay, that's normal, I think. That's a little concerning to me. 7 out of 10. I'm worried about compartment syndrome with that. Raynaud's phenomenon is reporting throbbing, tingling, and swelling of fingers on both hands. That might be normal for them, but I'm still gonna check on it. Okay. Okay, for side plan, we should client 2 days post-op coronary artery biopsy cabin. That's normal, I think. Central venous. As a pig line. What's up with these priority questions? Two days post-abdominal aortic aneurysm repair. Pedal pulse decrease from baseline. Sure. 2 days post-coronary bypass, post-cabbage. 18. Oh, that is so high. What is going on here? Cardiomyopathy or injection 25 dyspnea and dyspnea on extrusion. I don't know what EF is. Pneumothorax or chest tube negative suction, subcutaneous emphysema. Really? Elevated blood pressure on the underlying infection. Yeah. Pulse. Okay. Absent for 12 hours. Pedal pulse decrease baseline. Absent. Occlusion is condition. Arterial or graphic occlusion. Okay, you're right, because it's the aortic aneurysm repair. Subcutaneous emphysema tissue. I was like ER5, I think. Okay. Decrease ejection fraction. Decrease cardiac output. Oh! Ejection fraction. Okay. So, aorta first. Pulseless, femoral, skin color, temperature, lower extremity of a first pulse can be absent first 12 each phase is passing around the pulse decrease on baseline. Painful, cool, or moderate extremity, 2 baseline indicated present. ABC, come on. A nurse is teaching a client with advanced chronic obstructive COPD to prescribe theophylline which do not take with the rapamine. That's nuts. Okay, I was like, technically still be on the bottom. Let's do. Let's do. Acquired bypass. Another cabbage. Elective cabbage. I don't know what that is, but I don't like it. I don't know what that is, but I don't like it. Conducting education, community outreach, melanoma screening. Blockchain says. That's true. All new growth. Not all new growth. What? What's going on? Whoa. Whoa, 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 whoa. No! There's a fucking tracheostomy. And secure with tape. That was suction. You would insert a new one? I did not know nurses are allowed to do that. I was not taught how to do that. Insert a new tracheostomy tube? Excuse me. I don't even know what a terminator is. Okay. Nurse inserting tracheostomy tube. What the fuck? That is so cat.
Hi, I'm Ellis with Level Up RN.
I have never seen
In this video,
anyone.
I'll be doing
I have never been taught. Inserting catheter.
thumb
Okay, yeah,
Head.
it's inserting the catheter, not inserting
And
the
allow
fucking
him-
tube. What the fuck do you mean? Okay. I guess in emergency situations, that's what we can do, right? Alright. G2P1. Throbbing headache. 7. Vision. Alright, you have fucking hypertension. I don't want you to have hypertension. You have preeclampsia. I already know. It's a question on preeclampsia. I know. Clonus present. Yep. I bet you also have epigastric pain. Yep. Blurred vision. Yep. Yep. Seasonal allergies. Not a problem. Heart tone's normal. +2 pitting edema. Okay. Fetal movement. No contractions. Soft tone. 1 centimeter depth. -3 station. Cephalic. Good. Cesarean 5 years ago. 40 weeks gestation. Breech. Uh-oh. Breech is no good. This is correct. Preeclampsia is hypertension, proteinuria, and visual disturbances. Throbbing headaches too. Where's protein? Yeah, creatinine is increased. Yeah, that's right. That's right. Serum creatinine and 24-hour protein. Initiate preeclampsia? I think that's seizure. No. Magnesium sulfate, yeah. Antihypertensive, yeah. Misoprostol? It's not indicated because misoprostol is contraindicated with C-section. I'm gonna get 100% of this shit. There we go. Assess the client which action immediately perform. Okay, let's see what happened. I need to sleeping, not easily aroused, magnesium sulfate, D10 reflex, menial lochia, fundus firm, oxygen mask, 8 liters, health radar notified, drag fundus firm. Huh? What happened? Is there more stuff going on now? What's going on? Oh, our postpartum. From a midline, that's good. We don't need a fundal massage. Why do we need what? I think calcium gluconate antidote is not easily roused. D-tendon reflex 1, minimal locia, urine output 28. That's okay, 28 is a little bit lower. Let it dry, no more foul smelling. That's good. Output 5 new over the past 4 hours, though. And states cannot quite latch. Even on my worst day, tonight is a rough day. All that you can see her. Cause I loved you, I swear I loved you. No. It's improving. I was like, these two are not related to the actual thing. Kinds of knowledge, clean, dry, intact, indicates healthy, preeclampsia severe, and organ dysfunction earlier. Okay. Well, that's what question. Okay. Cindy taught me well. Oh, facial edema is one of them? Fuck. Okay. No, I know. Cindy taught me well. Cindy taught me well. I know preeclampsia inside and out. At least mostly. Kind of. Yeah, edema on the face. Sure. Angioedema. ED allowed to leave against medical advice after risks are discussed. No. Can't do that. They got no rights. Let me get water. They got rights, but not really. Care for a client with open appendectomy. Uh-oh. Clinical data. Which the hell's going on there? Well, catheter clear, yellow, diminish. Lateral valves are absent, also quite a clip that has to do with lattice. Okay, sure. Progress notes. Intake, urine output. Okay, I'm okay with that. The urine output. Temperature is fine. Blood pressure is a little low. Heart rate is a little high. It's actually pretty high. I don't like it. I don't like the heart rate. I don't like the heart rate. What? Wait, so how do I go between exhibits? What? How do I go between exhibits? What? How do I? How do I? How do I know? What? 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 What do you mean? Yeah. Okay. Alright. Which healthcare news should nurse clarify? You can remove it. Okay. How's your urine output? Urine's pretty good. Respiratory. Ambulate 3 times? I mean, I don't like the ambulation because your Your blood pressure is very, very low. Stop it. I didn't cross you guys out. Advance a regular diet. I mean, you can take that. Denies passage of 5 minutes in surgery. What are we? How many days out? How many days out are we? 24 hours appendectomy. Yeah. I think you advance to regular diet. Maybe like 3 times. Actually, that's pretty okay. Increase saline. Why are we increasing saline? Why are we? It can increase. Wait, 12 hours. What is it? 24 hours? I think after 24 hours they can eat. Or wait, no, appendectomy. No, that was appendectomy. They can eat after 24 hours. Fuck. Ability to pass gas. Encourage lung expansion, yes. Hypertense. Okay, so treat hypertense. That's hypotension. And you can remove it because they're fun. Pneumonia discharged 3 days ago. Less productive cough now requires sharp chest pain. Okay. Pleural friction rub. That's bad. That's gonna hurt. That's gonna hurt like ass. About GERD of a newborn. No. No. Yes. 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 I think that's true. No. Not on this side. Not on this side. Not on this side. Diagnose developmental dysplasia of the hip. Oh. So that can be caused by the meningocele, something, cerebral palsy. Not cerebral palsy. Not cerebral palsy. Anything caused by when like the spina bifida. There you go. And spina bifida cause developmental hip dysplasia. I think it can. Yeah. More common disorders. What do you know? What do you know? Dress a child in a shirt and a knee sock under the straps. Actually, okay. Let me rethink this. Apply lotion does not make sense. Dress the child in shirt and knee socks before the straps. No. Lightly massage the skin. That makes sense. Place the diaper under the straps. Yeah. The harness during diaper change. Place diaper under the straps. So, t-shirt and things under, socks under, diapers under. Do not remove harness. Do not apply lotion. That's just stupid. That's just stupid. Hospital nurse is coming on duty, notifies the unit delay. I was like, polycythemia isn't that just a lot of red blood cells? It can cause cancer, actually. Uh, it can cause like a type of yeah, type of cancer. But you just draw their blood. Lobotomy. Okay, plants, apical heart rate. Okay, 1, 2, 3, 4, 5. Midclavicular. It's like right here. That's true. Midclavicular. A 3-month-old infant is treated in the emergency department for spiral femur fracture. What? A spiral femur fracture? That is cap. No, question of parents about where the infant sleeps. Report the injury. Spiral fracture is long, yes, it's never mind, never mind. Remember. Left to right heart shunt. left to right. This is probably due to transposition of the rear arteries. What? 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 This is the transposition of the rear arteries. Wait, no. No, it's not. No, it's not. What? Diaphoresis during. Oh, okay. Left to right, pulmonary congestion causing breathing. Oh, okay. Tachypnea, diaphoresis during feeding, heart murmur, increased metabolic weight with poor weight gain. Oh, I thought it said weight gain. Okay, okay. Left to right sided heart shunt. Left to right sided heart shunt. The pressure on this side is going to be greater, so it's going to keep pushing back. So we're going to have like a lot of fluid just running into the lungs. So diaphoresis. Well, when we also have clubbing, when we also have large university receives student telephone message. A nurse in a student health center, large university receives student telephone message about possible exposure to viral meningitis. Yeah. Lift arm past the waist due to extreme shoulder pain. Unable to lift the arm past the waist due to extreme shoulder pain. Probably dislocated shoulder. Panic stricken with severe vaginal pain. You probably do. You're concerned about possible exposure. Woke from deep sleep in a family dormitory and is panic. Panic stricken. And is panic stricken with a severe vaginal pain. That's sexual harassment, maybe? I want to say sexual assault. Saying there's saying. Uh, Fair cough injury, yeah. So you can take NSAIDs and seek medical evaluation. Vaginal discharge, like, yeah. Okay. Sufficient B12 intake. B12 is not in fruits and vegetables. Iron absorption does not go well with vitamin C, I think. What? What is this?
Your head, keep your eyes. Tell your friends we're up for a take the road less traveled by. Tell yourself you can always what started beautiful. It's the heart that's the thing about us. Bears and then destiny and the long stairs at the door. Just it's not the place, but it dies and it dies and it dies. Little time. Leave the perfume on the stove that you picked out just for him. You leave no trace behind. Like you told me. Oh, like they are. Like dwindling of your
There's something sweet there.
That's the thing about illicit affairs. Clandestine meetings and stolen stairs. They show the truth single time, but they lie, they lie, they lie. They forget they will tell. And you wanna see time, call me time, call me baby. It's got to say it, that's they should be. It's anyone has baby. It's your baby. You talk it secret. And you know damn well that you are myself. Little time.
What? It's not a hemorrhagic stroke. No, I disagree with that. Hold on. Strokes are part of neuro, right? Bro, thrombolytics is ponderated after 4.5 hours. When on active bleeding. A ischemic stroke is not an active bleed. Ischemic stroke is is formed by thrombins. Thrombolytic agents are often prescribed in acute thrombotic events. Ischemic stroke. Yeah. Literally say ischemic stroke right here. Huh? Alteplase are often prescribed to resolve acute thrombotic events. Ischemic stroke, what we have right here. Myocardial infarction, mass pulmonary embolism. Yeah, I know. I know what alteplase does. It's a thrombolytic. It's used for ischemic stroke. I specifically look at ischemic stroke. Because if it's a hemorrhagic stroke, then you don't want to give thrombolytics. Thrombolytic agents are contraindicated in clients with active bleeding. There's no active bleeding. Active bleeding, recent trauma, aneurysm, mitral venous malformation, history of hemorrhagic stroke. So, I'm sorry, what? Can I question this? How do I question this? I don't understand how this question is false. The patient has an ischemic stroke, and in the explanation, it literally says alteplase is used for ischemic stroke, and patient is patient does not have other histories provided. I don't understand that. I seriously don't understand that. Okay, I'm gonna pee. I have like 10 questions left. Where are you supposed to go? Prenatal care entering the second trimester. Okay. Which should fall in appropriate second trimester? Sure. Anatomy evaluation. I think that's third trimester. Yeah, sure. Yeah. And gestational diabetes screening. That's the first. What? That is wild. Okay. Quickly. Fetal movement. Question example 2. Ultrasound performed fetal anatomy and placenta. Okay, gestational. I thought gestational diabetes testing is in the first trimester. Expect to have abdominal ultrasound. Sure. Okay, second trimester, fetal movement, anatomy, weight gains normal, increased consumption of iron-rich foods, and then gestational diabetes screening is second. Okay. Because there's 2 tests. There's the 1 hour and there's like the 1 hour and the other test. Where'd it go? 1 hour. Trust me. Alright. Feeding tube become obstructed. Flush it. Extubated. Narcotics. Oh, okay. I don't know if I would administer narcotics. Yes. No. Yes. Yes. No. Okay, this one's correct. Okay, so you don't want to give anything oil. I remember I got this wrong yesterday. So no oil, no ice chips, nothing in the mouth. Nothing in the mouth. NPO. Cleansing an enema. It's in a left lateral position with the right knee flexed. Encourage client to retain. Yes. Insert tubing and rectum with the tip. Yes. Keep the enema solution refrigerated until. No. Stop administering briefly. Yes. Okay. Yeah, that's right. Prepares administer of IV albumin, severe liver disease, low serum albumin 1.5. Hypoalbumin. I don't know. Pitting edema. It's not easy bruising. Not enough albumin. Loss of body hair. Just kidding. Oncologic albumin 3.5 to 5. Oh. It's like potassium. Large piles of protein prevent fluid from leaking out of vessel. We can go to the next one. Liver disease. Hepatic encephalopathy. Loss of blood hair. Hormone. Also, yeah, pitting edema seems pretty. 60-year-old client says my hands have been shaking when I try to cut food. I did some research. It could have Parkinson's. Make sure you tell your physician about your concerns. Parkinson's is not usually kind of. Tell me more about it. When do they start? Okay, I know it's not these two. Most helpful. Fucking bitch. Oh my god. Most helpful response to knowledge and concern and ask more information. There's no sense. There's one for a focus physical on this given you information. It's not like we can diagnose them to be like, oh, you have Parkinson's. I guess that's not therapeutic. I'm sorry. Resuscitation progress. There's a fallen action resuscitation team member who paused and person intervened. That's about right. Every 2 minutes? Left. No, it should be here and here. Should be here and here. So, no to that. Manual breaths are delivered at a rate of 2 breaths per 30 minutes. Yes, resuscitation needed and cleared. Should be should be double. Okay. Upper right chest, left lateral chest. No. What?
Now is the last time I think about what happened. See my face.
Oh, I thought it was like the toilet seat's just not there, like Ray's toilet seat. Okay, need mobile editor to maintain.
So I showed up at each party. Yeah, I showed up at each party. Yeah, I showed up at each party. So yeah,
Talked about 4 days, really? Wow, it's crazy. Spironolactone, potassium. Okay, fasting. Most concerning to the patient. Muscle cramps. Because hyponatremia. Calcium channel blockers. That's for your calcium channel blockers. Calcium channel blockers end in peen, like nifedipine, but also verapamil that can verapamil that can be used with digoxin. Digoxin that can be used with yeah. Okay, so nifedipine. And then you're gonna have flushing, edema, headache, but it decreases your blood pressure. And it treats hypertension. Flushing, vasodilation. We have and no grape juice. No grape juice. Okay.
Flowers to the east, clowns to the west. I give you my sunshine, I give you my best. But I need some sunshine. I'm a fire, take your breath away. If you gotta escape, I'm the way. Secret, devil's and details, but you got a friend.
Thyroid stimulating hormone high means you're not having enough thyroid. So you need to increase your levothyroxine intake. Mr. Oral liquid 2 months infant, parent understanding dose. 2-month-old? They can sip on it. No. No, I don't like that. I like this one. Syringe. Back of cheek. Although competing methods, the medication does require more accurate measurements. Syringe can be accurate if it have decreased dispensing of the back, then increase risk of aspirations and required to receive entire dose. Should never be mixed. I agree. Yeah, that's accurate. Yeah. What's gonna happen? I think it's like 60%. 69%? Shit, okay. Not bad. Not bad for today. Alright, that's the end.